I am Dr. Becky Lynn. I'm an OBGYN. I run Evora Women's Health. I'm here in St. Louis, and I'm also an adjunct associate professor of OBGYN at St. Louis University. Evora Women's Health is a full-service women's wellness center where we pretty much do comprehensive gynecology, women's wellness annual exams, but we also focus a lot on perimenopause, 40s, 50s, 60s, and sexual health. We're a concierge practice. So by that, I mean, we give you the time that you need. So there are no 5-minute visits in my office. We really spend time with our patients. The first visit is always an hour. We really give you all the time you need, and we're not constrained by time limits. So I keep my practice small so I can give everybody the time and my attention that they need. So funny thing, today, the day that I'm giving this talk, I was reading this morning my cell phone. I was reading the news, and I ran into this this quote from Michelle Obama, and it says, "What a woman's body is taking her through is important information. It's important to take up space in a society because half of us are going through this, but we're living like it's not happening." So really what I'm going to focus on today is giving you the information that you need about women's health issues so you can be your own health advocate and sort of end the shame in talking about women's health issues, right? And we'll go through a variety of women's health issues that I want you to gain some knowledge and information on, so that way that'll give you the confidence to work through it and empower you to be your own health advocate. So, and the other side of that same coin is women's health issues can affect confidence and productivity at work, right? We're all working really hard, trying to be successful, and it's no fun when those issues that are so shameful in our society, like period problems, leaking urine, hot flashes, they're so shameful in society when really they shouldn't. They're just normal. They're part of women's health. And if you have to be hush hush about, oh my God, I'm so embarrassed, then it can really affect your own confidence and then how productive you can be and are at work. So that's what we're going to focus on today. And knowledge is power. So my goal is to run through some of those issues and give you the knowledge that you need to understand what's normal, what's not normal, and what can be done about it. So in doing so, we have to do a little mini med school. So the talk's a little scientific, but I think it's important that you're armed with appropriate information, because we all know that when you Google search health issues, you can fall down a rabbit hole of marketing mayhem, which will make you, think you need to buy 12 million supplements, which, by the way, you don't. So I think it's important to get good information from a reputable source, obviously an OBGYN. So that's what we're going to do. So we are going to focus on these issues today. Whoops, I forgot to start my time clock here. So we're going to focus on irregular and heavy periods and also endometriosis. I'll explain what all of this is. We'll talk about incontinence, which is leaking urine, totally embarrassing, hot flashes, depression and anxiety, and insomnia or inability to sleep. And these are common. I see these in my practice all the time and can be so embarrassing, and we want to get through that. So at the end of the talk, if we have time, we'll do a little breakout room and we'll discuss this question. So I just wanted to plant the seed and let you think about this. So can you think of an instance where a female problem occurred at work or affected you or a coworker's ability to work? How did you handle it? And were you or your coworker embarrassed or ashamed? I think we can all probably think of something like that. And women's health needs change over the lifespan, but some of the basics stay the same. So today's talk is really not going to focus on the basic wellness. You all know, right? I'm not going to go through eat, fruits and vegetables and unprocessed foods and exercise. I really want to focus on these issues because they don't get talked about enough, and they're just as important as good nutrition. So let's start with menstruation, right? pretty much all of us have done it at some point. This is Stephanie Gongoria, who filmed herself bleeding right through her white yoga pants. So talk about brave. I don't think I would be brave enough to do this, but the point was that it's normal. Periods are normal. We're all having them. She got some flack for doing this, but you know, how many women have leaked through their tampon or their pad and been embarrassed about it? But periods are normal. They're part of life. So some of the things that women can run into are irregular cycles, meaning they're coming more frequently than once a month, or really heavy cycles. And there are a lot of reasons women can have these issues. They can definitely be related to their hormones, if their ovaries are not making hormones like they normally do, or it can be due to other hormones like thyroid or prolactin levels. Prolactin is the hormone that helps you make milk when you want to breastfeed. It can also be due to structural problems like fibroids. So fibroids are little smooth muscle growths that happen. They're benign. They happen in the uterus. Some women will grow polyps, also benign, little glandular things that grow inside and cause irregular bleeding or heavy bleeding. And then, of course, anybody who has irregular bleeding, you always want to think about pregnancy. Make sure it's not pregnancy, unless you want it to be pregnancy, then you want to make sure it is pregnancy. So the point I want to make, and the knowledge that I want to empower you with, is that the pill is not the only treatment. I see many women come in and say, oh my gosh, my periods are crazy, but I can't take the pill. For whatever reason, pills have side effects. All medicines have side effects. But what I want you to know is the pill is not your only option. And in fact, there are way better options than the birth control pill. So there's rings, and these are birth control rings. There's the NuvaRing. There's a newer one that's Evora that lasts a whole year. And you put these, they're soft, flexible rings. You put them in the vagina. You leave them there for 3 weeks, take them out for a week. That's when you have a period. They do an excellent job at regulating your cycles. So you're only having a period once a month, and also lightening your menstrual flow. And they also decrease your risk for ovarian cancer and work really well. And you don't have to remember to take a pill every day. There's also Iuds, and many of the Iuds contain progesterone. And so, for example, the Mirena, many of us have heard about the Mirena. 20% of women with a Mirena will not have a period at all. The other 79% have much lighter flow. So it's a great treatment for irregular, heavy periods. There's always 1% of people who just bleed all the time and it just didn't work for them. If you can't use hormones, or you don't want to use hormones and you're done having children, you have another option, and this is uterine ablation. And maybe you have friends who've had this, but basically it's done in the operating room. It's not a hysterectomy. You leave the OR with everything you walked in with or rolled in with, and you're asleep for it, so you don't feel a thing. And for lack of a better word, your physician burns the lining of the uterus, promise you don't feel it. And it's that lining that you shed each month that's giving you trouble. So you you coagulate the lining of the uterus so you don't bleed as much or as often. And it works about 90% of the time. Last resort is always major surgery, hysterectomy. And I also want to point out, I think it's confusing to a lot of women. Hysterectomy just means remove the uterus or the womb. It doesn't mean remove the ovaries. So you can have a hysterectomy with removal of the ovaries, which is called a salpingo-oophorectomy, or you can have a hysterectomy alone. If you leave the ovaries in, we're not putting you in menopause. We're not messing with your hormones. It's your ovaries that make the hormones. So there really are a lot of options. You don't need to go to work worried that you're going to bleed through your pants. So I want to turn now to endometriosis, and I'll explain what this is. Another really common women's health condition. So endometriosis is when you have endometrial tissue. So that's the lining of the uterus, the tissue that you normally would shed each month. It is found outside the uterus. So on the ovaries, on the bladder, on the bowel, it causes severe, severe pain. So this happens in 1 in 10 women, and most women will have severe, severe menstrual cramps with endometriosis. So, if you know 10 women, if you know 100 women, I mean, just think of how many people you know have endo. I'm just going to call it endo. So here is a quote from a real Evora patient who said, I had so much pain that I would be nauseated and throw up. I wanted to cry, but I felt like no one would understand if I had to go home because of period cramps, right? I mean, everyone has period cramps. I didn't want to be perceived as weak or like I was making excuses not to work. But this pain is real, very, very real, and can be really life altering. So I want you to know that there are things you can do about it, and don't let anybody tell you, oh, the pain is in your head or you must be depressed. And actually it takes a woman with endometriosis on average 7 different physicians before she gets to that diagnosis, and it causes chronic, terrible pain. So this is a funky picture. Mini med school. This is a normal uterus. It's as if you chopped somebody off at the waist and you were looking down into the pelvis. This is the uterus. These are the tubes. The ovaries would be out here and out here. And this is a uterus with endometriosis. This is endo right here. It causes inflammation. It causes scarring. It looks like these brown powder burn type things. And as you can imagine, it causes a lot of pain. And not only does it cause painful menstrual cramps, it can cause painful sex. And talk about shame. And I want to put an end to this. It's so important to me, since a lot of my practice focuses on sexual health, and sex is normal. We're all doing it. And women who have endo tend to have painful sex, and they're so embarrassed. They don't know who to talk to. Their partners don't understand. And the good news is there are things you can do. So now you'll be armed with this knowledge. So what do you do for endometriosis? Sometimes we use hormones, and by suppressing ovulation or preventing your ovary from releasing an egg each month, we can prevent your ovary from making lots of estrogen, and estrogen stimulates those endometrial implants and causes them to grow and cause lots of pain. Sometimes we use hormone blockers, where we block the ovaries from making any estrogen at all, and it throws you into a little menopause, which is no fun. So as you can imagine, there are a lot of side effects. If you do that, we do it short term, and we don't do it long term, because we don't want to take somebody who's in their reproductive years, like 30-year-old, and make them menopausal. That sounds miserable. The only way to diagnose endometriosis, by the way, is seeing it at the time of surgery. So we do laparoscopy, where you get a couple little incisions on your belly. We look inside and we can be like, oh yeah, there's endo. And then at the same time, we can remove it. If you do this, I would recommend that you see someone who's very familiar with endometriosis and who's a MIGS surgeon, which stands for a minimally invasive gynecology, because they're highly skilled at removing endo and getting every last bit out. Last resort, as always, hysterectomy. And then I also want to point out that women with endo have so much pain that they develop pelvic floor muscle spasm. And your pelvic floor, let me see if I have it here. Oh, nope, I don't. So the pelvic floor are those muscles that, like, we tell you to do when you do Kegel exercises. So as if you were peeing and you had to stop the stream, like somebody walked in the bathroom and you wanted to stop urinating, that's your pelvic floor. And so a lot of times these women develop pelvic floor muscle spasm, which leads to painful sex, which is awful. All right, so that was the menstruation, endo. We're going to turn now to urinary incontinence, which can affect women of all ages, and talk about embarrassing. So this is a real Evora patient. She said, I couldn't sit in a board meeting for very long without needing to pee. I dreaded these meetings. I was in a room full of men and thought I was going to wet myself. Not fun. So mini med school, here's a little bit about urinary incontinence. There are different types. You can have stress incontinence, which means you leak urine with cough, sneeze, laughing, picking up a heavy box, or urge incontinence. And urge incontinence is where your bladder is like a water balloon. It's surrounded by muscle. And when your brain tells that muscle to squeeze, that's when you pee. But sometimes that muscle has a mind of its own and it just squeezes. And that's urge incontinence. So this is the typical person who like walks in the door and goes, oh my God, I have to pee. And before they get there, that bladder muscle squeezes and they leak urine everywhere. And then some people can have mixed incontinence, which is just both. So if the trampoline is your biggest enemy, then you likely have stress urinary incontinence. Don't jump on the trampoline, which is a bummer because I actually like trampolines. So what do? There's a lot of treatments for urinary incontinence. And as you can imagine, it's highly prevalent. And you don't have to be 70 years old to leak urine. It totally happens after pregnancy, after childbirth, sometimes during pregnancy. So this really occurs across all age spans. So what can you do? You can do Kegel exercises, which is sort of what I was talking about, where you contract the pelvic floor and relax the pelvic floor. For some people, that's hard to do, and it's hard to do it correctly. So if Kegels aren't working, you can do pelvic floor physical therapy. These are the pelvic floor muscles. I'll go back to the other slide in a minute. So this is like your pelvic bone, right? This is a vertebrae, same thing, you're chopped off and someone's looking down into you. And the reason your organs don't fall out, your uterus doesn't fall out, the bladder doesn't fall out, is because you have this, hammock of muscles right here that all those organs sit on. So pelvic floor physical therapy just helps you strengthen these muscles. We sometimes recommend fluid restriction because, everyone's been telling you to drink so much water that your bladder is always full, and that leads to both stress and urge incontinence. Weight loss really helps in women who are overweight or obese and they cough, just more likely to leak urine because there's more pressure coming from the abdomen. Emsella is a chair, which looks like this. We have this in our office and women just sit on it. You don't have to change clothes. It's not like anybody's touching the urethra or the bladder or the vagina, and it contracts and relaxes your pelvic floor for you. You could also consider a pessary. This is a pessary, which is this little, kind of looks like the old time diaphragms, but you just fold it up. Sounds weird. It's foldable. You put it in the vagina, it opens up, and there are ones that are specific to incontinence that press on the urethra. So when you cough and sneeze, you don't leak urine. And one more little thing is a lot of women will leak urine like when they run or when they exercise, but no other time. And if you don't want to get a pessary, which you remove and put in and take out yourself, you can always just put a tampon in when you go running or when you're doing exercise. So just a little pearl. And then, of course, last resort always is surgery. You can have surgery. We talk about, we put slings, which is like a little tape under the urethra. The urethra is the tube that goes from the bladder to the vagina that you pee out of. So we leave that as a last resort. So what about urge incontinence? You've probably all seen this little bladder who's like, pulling this woman along. I think it's a commercial for Myrbetriq. If you don't get to the bathroom in time, the bladder muscle spasms, you lose all your urine, totally embarrassing. And then women have to wear diapers or they're wearing pads. By the way, there are special incontinence pads, which are better for the vulvar skin. So if you leak urine, you don't want to wear menstrual pads. The incontinence pads soak up more fluid. So what do we do for urge incontinence? So we do something called bladder retraining, where we tell you, okay, so now today you're going to go pee every half an hour, whether you feel like you have to or not. And then you'll do that for a couple of days. And then you're going to go to every hour. And then you're going to go to every 2 hours. And so you're going to find that sweet spot where your bladder doesn't get super duper, super full. But you're going to the bathroom every 2 hours, so you never get to that point of overflow where you just lose it altogether. There are a lot of medicines on the market for urge incontinence, things like Myrbetriq, Vesicare, Ditropan. I don't work for any of these pharmacy companies, by the way. And they just prevent that bladder muscle from contracting. We do fluid restriction. Not everybody has to, drink gallons and gallons of water every day. If your urine is a light yellow, you're hydrated. You don't need to guzzle more. The Emsella works for urge incontinence. That's the chair. And yes, there's Botox for the bladder. I wish I knew how to do this because I think it works really well. And maybe one day I'll learn how to do this. But Botox paralyzes muscles. So there are urogynecologists. And if you live in St. Louis, I can refer you to some who do Botox into the bladder. And it just prevents that bladder muscle from spasming without making the bladder muscle unusable altogether. So I'm going to turn to hot flashes now, because this is definitely something that can show up at work and be incredibly embarrassing. You don't want to look like this in your work meetings. You'd rather look like this. right? Confident, empowered, you know, you don't want to be sitting there sweating and worrying that you look nervous. So here's what a patient told me once. She said, I always seem to get hot flashes during an important presentation at work. I would start to sweat, my face would turn red, and I always felt like it made me look nervous or not confident in what I was presenting. And it was just a hot flash, so it was out of her control. It just happened. It didn't mean that she was nervous or unprepared or anything like that, driving her crazy. So what is a hot flash? It's a sudden wave of heat, often accompanied by flushing. Some women will actually shiver and get cold afterwards, and it's due to declining estrogen levels. So you don't have to be menopausal, which, by the way, means you're not having periods, and you're of the age of the average age of menopause is 51. So the way that we define menopause is actually going a whole year without having a menstrual cycle in a woman who's not like 20. Like if you're 20 and you don't have menstrual cycles, there's a whole bunch of other things we have to worry about. And so hot flashes happen due to declining estrogen levels. Your ovaries just aren't making as much estrogen. And women can get these before their periods stop. So don't let anybody tell you you're crazy if you're 40 or 42 and you're like, ooh, I'm so hot. Even before your periods go away, you can have menopausal symptoms. And for most people, hot flashes last for a couple years before the actual last period and then a couple years after. But some women have hot flashes well into their 70s. And for some women, they can be really miserable. Other women, they just barely even happen and they're not bothered by them. If they bother you or get in the way of work or life or overall happiness, there are things you can do for them. The gold standard treatment is hormones. So you can either use estrogen and progesterone if you have a uterus, or estrogen alone if you don't. If you can't use hormones or you don't want to, you can also use some of the antidepressants, work well for hot flashes. And then there's the basic things: dress in layers, avoid triggers, bring a fan. There's even like a pillow if you get night sweats that you can freeze. It's called the chillo, and then you rest your head on it. It's nice and cooling. All sorts of things out there, because if you live long enough, you will go through menopause. So now the $1 million questions: are hormones good or bad, right? And who do I believe? So when I'm talking about hormones, I'm talking about estrogen and progesterone and testosterone. These are the hormones that your ovaries make. There's thyroid hormone, there's prolactin, there's a whole bunch of other hormones, but I'm really talking about the reproductive hormones, these ones. So little bit of hormone history. So, and I'm going to try and make this brief. In the 90s, we thought hormones were the greatest thing since sliced bread. We put every woman on hormones till they were 99 or 100 years old. They were awesome. And we thought that, you know, that we could prevent heart disease by putting women on hormones. But there had never been a really good clinical trial evaluating that. So the NIH in the late 90s started the Women's Health Initiative. And if you were around back then, you might remember it was like 20 years ago now. And they gave women Prem Pro, which is one formulation of hormones, estrogen and progesterone, and they followed them. And they were looking to see if it decreased the risk of heart disease. But lo and behold, what they found is in this group of women on Prem Pro, it increased the risk of heart disease. And the media got a hold of this, and hormones were bad, 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 bad. And everybody stopped their hormones. But over the last 20 years, and these are not birth control pill hormones, these are low, low, low dose of hormones for hot flashes. Over the last 20 years, we've continued to collect data, and we found that hormones in the right woman in the right timing can be good. That what they did is they broke down those participants in that trial to ages 50 to 59, 60 to 69, 70 to 79. And lo and behold, in women in the 50 to 59 age group, they did decrease your risk of cardiovascular disease. So by that, I mean your risk of having a heart attack or developing atherosclerotic plaques in your blood vessels that can cause heart attacks. So they are good, and they can have tremendous benefit in the right person at the right time. So they do have risks like everything. They can cause blood clot. So, you know, we tend not to want to use them in people who are, you know, really, really, really overweight or obese, or who smoke or have diabetes, hypertension, heart disease already. But in a woman in her 50s who's otherwise healthy, they not only prevent heart disease, they don't increase your risk of stroke, they lower the risk of you dying from anything, and they help your skin, right? So they help prevent wrinkles. Everybody loves that. And they keep your bones strong. and they keep your brain in shape, because in menopause, women get some cognitive decline and short-term memory loss. So this idea that hormones are all bad, it's a zombie idea. So this was coined by Paul Krugman, who won the Nobel Prize in economics. It's an idea that just won't die. And so even amongst the medical community, there's a lot of physicians who didn't learn about hormones and didn't follow the data, and really it just won't die when it should. So in the right person at the right time, hormones are good. They can prevent heart disease. In older women, it can increase the risk of heart attack. I mentioned no increased risk of stroke when started in the younger 50 to 59, but not when started late. Okay, so $1 million question here. What about breast cancer? Everybody's afraid of breast cancer. It occurs in 1 in 8 women in the United States. It's scary. We all know somebody, or we've maybe had it ourselves. So what do we know about that? So do hormones cause breast cancer? What is out? Like some data says they do, some data says they don't. So here's kind of where we stand. In that big study that I mentioned, they only looked at Prempro, which is estrogen and progesterone. Women on estrogen and progesterone had an increased risk for breast cancer, regardless of age. Women in the estrogen alone group had a decreased risk for breast cancer. So estrogen was protective. So then you might think, is it the Provera, or the progesterone, that's causing the increased risk of breast cancer? So we really don't use that progesterone much anymore. We try not to use synthetic progesterones. We use bioidentical progesterones, and this does not mean compounded. This means the same chemical structure as your own ovaries make. And there are FDA-approved bioidenticals. So Prometrium is the one that I like to choose because it has not been shown to increase the risk of breast cancer. But we do know that if there's a little hidden breast cancer in there with a receptor for estrogen, and you give somebody estrogen, it'll make that cancer grow. And we also know that having been on hormones increases breast density, and breast density in and of itself is a risk for breast cancer. So it's super, super complicated. So when you decide to use hormones or not, basically what you do is weigh the risks and benefits and decide, are the benefits greater than the risks? And then maybe you'll choose to use them or maybe not. I do want to touch on this whole bioidentical compounded hormone thing. I think it's really important. I feel it is my duty as an OBGYN to give you the correct information, because there's a lot of marketing craziness, snake oil out there. So in the early 2000s, when everybody quit their hormones, women were miserable. And these compounding pharmacies popped up that would sell you bioidentical hormones. And they did a lot of marketing to say these are natural, right? Natural is safer. But the truth is, natural is not always better. Cocaine is natural. It's not safe. I wouldn't recommend it. Natural is certainly not always better. So, and like I mentioned, bioidentical means it's the same chemical structure as your own ovaries make. And there are many, many bioidentical hormones that are FDA approved. So when drugs get FDA approved, it means that the drug company had to do a really good, really highly regulated clinical trial to prove to the FDA that the hormone is safe, that it's not going to kill you or cause any harm, and that it actually works for what the drug company is saying it works for. So everybody has this, we hate big pharma, they're price gouging us, and there's a lot of problems with big pharma. But when it comes to choosing a drug, you want a drug that comes from the evil big pharma, because they had to prove to US FDA that it's safe and that it works. So what about these compounding pharmacies? And compounding pharmacies aren't bad. And there are drugs that don't exist for women that sometimes we use compounded for. But if there's an FDA approved choice, you should choose that, because it's safe and effective. And a lot of these compounding pharmacies will prescribe estrogen and progesterone. And the thing is, if you have a uterus, you need progesterone, because if you give somebody with a uterus estrogen alone, it increases the risk for uterine cancer. So the thing is, in the compounding pharmacies, it's never been tested, these compounds. So you don't know if you're giving somebody the right amount of progesterone to not increase their risk for uterine cancer. And when you pick up your compounded hormone, right, there's no package insert And if you have ever looked at a package insert, it will scare you to death. You'll never take another medicine in your life. But the compounding pharmacies don't have to include the package insert. So I feel like women have been led to believe that compounding bioidenticals are natural, safer, and better. And they're not, because they haven't been proven to be safe or effective by good scientific, evidence-based clinical trials. It's plain old science. But the marketing of them, oh my God, it'll make you believe you all need to be on them, even if you're not having hot flashes. There is a lot of money to be made in the compounded bioidentical hormones. So the marketing dollars are huge. I want to point out BioT and the pellets. So, and I know this is big in Colorado because I've given some talks out there, and I know there's this BioT, it's a franchise, and they do hormone pellets for women. And, you know, these also have never been studied. And every time I give a talk on hormones, I go to the medical literature to see if anybody's looking at the pellets to make sure they're safe and that they're effective. And I never find any published, peer-reviewed, evidence-based clinical trials about pellets. And what I've seen in my practice is some pellet fallout, some pretty bad pellet fallout. Women come to me with male range testosterone. They have hair loss or male pattern balding, deepening of the voice, enlarged clitoris, and too many red blood cells. And a lot of these are permanent. So I saw a patient the other day who said, you know, when I did the pellets, I noticed my clitoris grew. And I said, yeah, you know, pellets do that. And she's like, well, it didn't go back down when I stopped taking them. No, it's permanent. And it pains me that women, at least here, I don't know if this is true everywhere, we're not appraised of those risks of using the testosterone pellets. I prescribe testosterone all the time to women, but what is recommended, and there's a lot of data on testosterone in women, is that you put the testosterone level in the normal premenopausal range, not in the male range, because it's in the male range where you have a lot of side effects. And people get too many red blood cells, which increases your risk of blood clot, which can travel to your lungs and kill you. One other thing I noticed on the BioT website, there is a disclaimer at the bottom that says these statements have not been evaluated by the FDA, and these products are not intended to diagnose, treat, cure, or prevent any disease. Oh, it drives me batty. There are safer, much safer ways to do hormones. All right, so I'm going to turn now to mental health. And I think this is really important when we're talking about shame and stigma. Your mental health is important, and it affects your physical health. And it's so common for women to struggle with anxiety and depression. And there are plenty of treatments out there, and they're not all drugs, right? There are so many things you can do for your own mental health, which if you're feeling good, you feel good about yourself, you feel confident, you do better at work, you do better at life. So mental health is really important, and it's really important we end the stigma surrounding mental health. So, oops, forgot the quotes, but this is a quote from Kerry Washington. And I remember that when I heard this, it really stuck with me. So I happened to be listening to a Goop podcast, which is Gwyneth Paltrow's podcast. Just so you know, I'm not a fan of jade eggs. Don't go buy them. Don't do them. No scientific evidence. But I do like her podcast when she interviews other celebrities. And I really like Scandal and Kerry Washington. So I was listening to this, and it was about mental health. And she said, everyone deserves a therapist. And I remember exactly where I was when I'm like, yeah, everybody deserves a therapist. And you don't have to be in the throes of depression or anxiety to get one. If you're just wanting to make changes for better mental and emotional health, then get a therapist. They'll talk to you without judgment. But if you're facing a crisis, anxiety or depression, maybe a major life transition, or some family dynamic problems or relationship problems or addiction or substance abuse, good time to see a therapist. Really important. They help you explore thoughts, feelings, and worries without judgment, right? So like, you know, many women talk to their friends, which is great, but you know, sometimes you find, well, I can talk to her about this and I can't talk to her about this because you're worried that she'll judge you. We all do this. I mean, I try not to be judgmental, but I think we all have our own biases. Therapists help you develop coping strategies. They can help you work on habits you want to change. They can improve relationships. Communication skills are key. They really help you feel empowered and develop fresh insights about your life. So you don't, so I guess my point is we got to end the stigma around seeing a therapist. Therapists work wonders. The last thing I'm going to talk about is insomnia or difficulty sleeping, right? This can affect how you feel the next day. So, or the whole week or every day. So this is what a patient told me. I was not able to sleep at all. It made me irritable and I was a royal biatch at work. I ate horribly, which made me gain weight. So then you feel bad about yourself, and I was depressed. If I could only get some good rest, I know I would be a much nicer person. Anybody who's got kids, anybody who's a mom, anybody who's had hot flashes can relate to this. You're not at your best when you have not slept. So what I see in my practice, why people can't sleep very commonly is stress and worry. You get those, you start worrying in your head, and it makes you a little nervous, it makes you excited, makes you anxious, and you get those neurotransmitters released in your brain that are your flight mechanism, right? Your runaway, and it keeps you awake. Very common. There are things you can do for that, or poor sleep hygiene. And by that, I mean, you're staring at a screen right before you go to bed. You drank a coffee an hour before you go to bed. Really, as far as sleep hygiene goes, we say your bed should be for sleep and sex, and that's it. Night sweats, menopause, even without night sweats, menopause alone can make it difficult to sleep. And then sleep is fairly common, especially for overweight or obese, another reason to lose weight. And that's that person who snores a lot and then they kind of stop breathing and then they go and they wake themselves up. Well, they never get into a good deep sleep. And then there's restless leg syndrome, which is a little less common, but it's where you feel like you constantly need to move your legs. So what can you do about your poor sleep issues? I happen to love this app, CBT Coach. It is free, I believe. I think it is, but I downloaded it, and it gives you these guided meditations. So for those people who stress and they worry and they can't stop worrying to fall asleep, you can listen to it, and it just takes your mind off the stress because you're more focused on other things. And I think it's great. And there's no risks, no side effects. You can do cognitive behavioral therapy. There are sleep therapists. If you're really having problems sleep, you want to see a physician who can figure out if there are any underlying causes that need to be treated. And as a last resort, you can always use sleeping pills. But the problem with sleeping pills is then it becomes harder to fall asleep without them. All right, so let's see. I'm at almost 40 minutes. So what I thought we would do is go back to this question here and do a little breakout room. So I know that Nina's going to do the breakout rooms and just kind of chat amongst yourself. Can you think of an instance where a female problem occurred at work to you, to somebody at work? How did you handle it, or how did she handle it? And were they embarrassed or ashamed? And how can we work to change that? So Nina, I'll let you take that away.
Great. Okay, so we're probably going to do 5 minutes. So I'm going to start the room now, and then Becky, it'll assign you to a room, but you don't have to go. You can just stay here.
Oh, okay.
Let me just, unless you wanted to.
I can go to the room. That's fine. Send me to the room, please.
Okay. All right, here we go.
Good morning. Am I in a room?
You should be, but I'm happy to, hold on, let me move you. Here we go.
Are we in a room?
No,
here we go.
probably not.
Okay, room 3, I see.
You're good.
I'm going to go back now and wrap up, and then I will happily take all sorts of questions. So let me share my screen again. Let's see here. All right. So I think we probably don't have time to come together and share all of our embarrassing things, and maybe you don't want to share it with the whole group, but it just sort of gets you thinking about where we are and how we can work to change that embarrassment, the shame, or the stigma about female problems. And hopefully you met some nice people in the breakout room. I did. So All right. So the takeaways that I want you to leave with from this talk are to end the shame around female problems. We want to normalize and legitimize, just like the woman who filmed herself in her white yoga pants and bleeding through them. And then I also want to point out it's really important to be your own health advocate. So in today's day and age of assembly line medicine, you're in and out. You don't have a lot of time with your doctor. And it's important to have this knowledge and go in armed with good knowledge. And if you're looking for things on the internet, how would you know what's legitimate and what's not legitimate? But I would think the best way to do that is to go through the national organizations. The American College of OBGYN has a lot of excellent information. The North American Menopause Society has a lot of excellent information. So it's hard to tease out what's a legitimate source, but the more you know, the more you can be your own health advocate. So I just want to tell you a little bit about Evora. So I personally found that operating in one of the big health systems where you get like 5 minutes with your patients just didn't do it for me or my patients. A lot of what I manage and take care of requires more than a 5-minute visit. So that's why I opened Evora. We're a concierge practice. We give you an hour at your first visit. We give you as much time as you need. You can bring up as many things as you want. It's really patient-centered, and not only problem-centered, but prevention-centered. So we do a lot of women's wellness. We have a weight loss program. This is my shameless plug. We have 2 registered dietitians, 2 personal trainers who work with our patients. We offer prevention and cancer screening. We do a lot with menopause and hormones. We do a lot with sexual health and sexual problems, the most common being low libido and painful sex. We have a therapist who's also a life coach, which I love that because she can do her therapist hat. And once you're feeling better and you've got things worked out, she can transform and wear her life coach hat. We also have a massage therapist, just because, like, who doesn't need a massage, and what a great way to start feeling better, and it's good for immune system. We also offer yoga at Evora. We do a cooking show called Evora's Eats. It's a Facebook Live. This is Rachel. She runs personal chef business. She's also our personal trainer. And Michelle is a registered dietitian. We do that once a month. So if you follow us on Facebook, and if you join our newsletter, we send out the recipe. You can make it with us. This is Casey. He's one of the personal trainers. Chloe is my medical assistant. Paula is our massage therapist, also a dancer, so she knows the human body. Jenny is our mental health therapist and life coach. And this here is Kelly, who I met through Rise, through one of the Coffee and Connections, and we connected, and she runs Offbeat Yoga in Chesterfield. And she has so graciously loaned me one of her t-shirts. This is Betsy, who does a virtual yoga class through Evora the 4th Monday of every month. And anybody can do it. You don't have to be a patient, and you can sign up on our website. So I love my team. I'm very fortunate to be working with everybody. And I want to thank Nina and Stacy and everybody at Rise and everybody who showed up and came to listen. Thank you so much. I feel really strongly about women's health. And so I vocalize a lot of my opinions on social media. These are my social media sites. My office is in Chesterfield, the phone number, this is the website, so feel free to check it out. And I am happy to take any questions, bring it on. So I'm going to go to the chat box because I can see that there are some questions. All right, let's see. Oh, okay. So I see a question that says, interested to hear my perspective on low libido in women, possible causes and treatments other than birth control. So this is something I see day in, day out. I specialize in sexual problems in women, and I'm also a certified sexual counselor. So libido is the most complex thing, especially in women. Libido is very contextual. It's not just being on a birth control pill. It can depend on so many things. You know, libido naturally goes down as you age. Your testosterone levels go down starting in your early 30s. It's not all about testosterone. It has to do with your relationship. Even in the best of relationships, libido goes down over the long term. Sometimes the best of relationships have difficulty communicating about sex. sex. Sometimes libido is low because sex is painful, and the pill can cause vaginal dryness that makes sex painful. Sometimes libido can go down because women sometimes have duty sex, where they just have sex even though they really didn't want to, but they do it for their partner and it's not great sex and they're not getting anything out of it. So they're like, well, not so great. So the next time they're presented with the opportunity to have sex, they're like, oh, no, not interested. It wasn't so great last time. So we talk about being selfish during sex and selfless. You do it for you do it for your partner. There are drugs that can cause low libido, like many of the antidepressants. There's just so many things, history of sexual abuse or trauma, inability to orgasm, maybe what your parents taught you that sex is shameful. So there's so many things. And yes, there are treatments. There's actually 2 FDA approved medicines to treat low libido in women, in premenopausal women. It's common in postmenopausal women, and we use testosterone for that. The ones that we use in premenopausal women, and you don't have to use them, there are other things you can do, are Addie and Vyleesi. Those are 2 that are available for women. Hopefully that answered the question. Any other questions?
Dr. Becky, I have a question with, I think we're all kind of still getting our arms around concierge medicine.
Yeah.
And there is no doubt, listening to your thorough presentation, of the immense value you bring. I think if you could help walk us through, please, and you don't have to get super specific about pricing, because I imagine that's tailored for each patient and you can't give a flat answer, but how does the pricing in general work, and how does that contrast to the more traditional methods of payment that maybe we're used to with the big insurance companies?
Yeah, that's a great question. I think it's really important. So we don't accept insurance for my services or for any of my ancillary services, like our therapist, our nutritionist. But what we do, because this is kind of a relatively new concept, is we will give patients a super bill with their diagnoses, with everything they need. They can submit to their own insurance for reimbursement. So that's one way that patients pay for care. The other way is you can use a health savings account or a flexible spending account. Patients do that often. As far as the way that we have our concierge, because I find that concierge means a different thing to different people. You can either do, we have 2 separate programs. You can either do membership or you can do fee for service. So fee for service is you just pay for each appointment, just normally when you come. So you do one appointment, it costs X. You do the next appointment, it costs X. Or the membership gives you a lot of added benefits. So the membership is really designed for prevention and overall health. So all those things that you don't get in a 5-minute pap and breast exam. So we talk about nutrition, we talk about exercise, we do breast cancer screening, and included in the membership, you pay a monthly fee. You also get a visit with one of the dietitians, a visit with a personal trainer. You get the yoga. We do a monthly box of healthy little samples and fun things. We did like a good protein bar. We did a little Chanel gift box. They gave us some good facial moisturizers. Loved that one. But we send a gift box each month. And then the membership folks also get discounts on any of the procedures that we do and anything that we sell. So we have the Amsella chair for urinary incontinence. I do vaginal laser for vaginal dryness due to menopause. So you get a big discount on those. And then, because I do sexual health, we have some lubricants and other fun things in the office that we sell. And so, and also for our members, they get unlimited visits. So there's no limit. And then for the members, I will also do after hours appointments. So for working women who just can't get away, or weekend appointments, I'll do that for the members. And all the members have my direct cell phone number. They can call me anytime. Nobody is, taking advantage of that, but it's really useful if on a Saturday you go to pick pick up your medicine and it's not there. Well, you can't call your normal doctor's office, but you could call me directly and I call it in for you. And it doesn't bother me in the least bit. I used to be on labor and delivery 24 hours. And that was, that's a lot of work. But for me to answer your call and call in a prescription, no big deal. So that's kind of how our program works.
Wonderful. No, thank you so much.
Sure. Anything else? Oh, I see one new message. Okay. Any kind of treatment that could hinder future pregnancies. So typically treatment for endo is going to help with future pregnancies, especially surgical removal of the endo that helps with pregnancies. And birth control, yes, it's going to prevent pregnancy, but it's also going to prevent the progression of disease or it from, becoming more inflammation, more scarring. So none of the treatments will hinder a future pregnancy. Even going on one of the medicines that makes you temporarily menopausal, once you stop those medicines, you go back to ovulating normally. Yeah. And if it's really bad and someone were to have problems getting pregnant, I would definitely see somebody who is specialized in endo. Medicine is so highly specialized now, and every doctor can't be a specialist in everything. So, and especially here in St. Louis, there's 2 really good MIG surgeons at SLU, and they really know endometriosis. So if I were having problems getting pregnant and I needed surgery, I would go that route. Usually the treatments prevent you from getting pregnant. And also endo pain tends to get better when you're pregnant. So all good news. Yep. Anything else?
Dr. Becky, are there any really common mistakes that professional women in particular are making, that just anything easy where you could clear up, any nugget of wisdom?
I think there's a lot of, the first thing that comes to mind is supplements. And my thought on supplements, there are some supplements women need, right? Like if you're not eating calcium in your diet, you need to take a calcium. But I feel like there's a lot of, oh my God, I have to take 10 supplements. No, you don't. Just eat healthy. Just eat right. I know that's hard to do in our society, and I break those rules all the time myself. But I kind of feel that for supplements. Otherwise, I do want to stress the importance and the value of exercise. Every little bit counts. If you hate exercise, get a friend to do it with you, make it fun, make it social. But exercise, we all know it helps prevent diabetes. It helps control your weight. And actually being overweight increases your risk for breast cancer and uterine cancer. And I feel like women don't know that. And if more women knew that just being overweight increased their risk of breast cancer, they would work harder to lose weight. But exercise keeps your brain young. I just read a study the other day about it, how exercise increases blood flow to the brain, which helps prevent stiffening of the blood vessels, which can lead to strokes. And it's the best thing for mental health. I didn't mention that, but seriously, way better than any antidepressant is aerobic exercise. Makes your brain release those neurotransmitters that are the same things that they give you in a little pill when you take Prozac, but they make you feel so good. And so the best thing for PMS, like premenstrual syndrome, for depression, for anxiety, exercise is really, really, really good for that. So I guess I'm a huge fan of exercise. And if you hate it, join a class, find a friend, make it social, just put it in your life somewhere, because you'll live longer. They've even found that people who exercise have longer telomeres in their chromosomes, which is a sign of longevity. So, and it keeps your brain fresh too. It's just like everything. That's the take home message on that.
Couldn't hurt with the libido either, right?
Oh no, actually, so that's a really good point. So exercise actually has been shown in women and in men to improve libido. So they've actually done scientific research studies, and it does improve libido, and not just by improving body image, right? So if we exercise, we feel good about our body, we're getting in shape, we're more likely to share. But apart from that, it does improve libido. So yeah, it's really good for that too. And, you know, and sex is important to a relationship, like really important. Another thing we don't talk about, but you know, who are we? We're like food, shelter, and sex. Those are the three main things we need. So I wish we could take away some of the stigma against talking about sex and sexuality for women. We talk about it for men, right? EDs like Viagra and Cialis are all over, but no one's talking about it for women. And I feel like I really want to advocate for women's sexual health, which is just as important as it is for men.
Well, thank you, Becky. I definitely
Sure.
agree with you on that. Do you have any tools, resources, anywhere other people can go outside of this to keep that talk going if they wanted to? I on your LinkedIn, I feel like there could be articles or things like that. So if you have any tips or tricks, let us know.
Yeah, so if you want information on women's sexuality, there's the International Society for the Study of Women's Sexual Health, or ISWSH, ISSWSH, full of quality information, scientific-based, evidence-based information about women's sexuality. I'm really involved in ISWSH, and I know that we're creating a patient-facing website because a lot of ISWSH is directed towards providers, but they are in the process of creating good quality information for patients. But if you follow ISWSH on social media, they have Twitter, Instagram, and Facebook, there's always good articles, good information about women's sexual health. If you're of the menopause range, the North American Menopause Society, their website is menopause.org, so easy to remember, has excellent, high quality, evidence-based, science-backed information, and they have really good patient resources. They have videos, they have handouts, and I follow them also on social media, and they're always, you know, whenever something is new or important or changes, they'll put it out on their social media also. So that's NAMS, North American Menopause Society, or menopause.org.
Thank you. Well, just to honor everyone's time, it is a little past 10:30, but this was so great. I'm sure everyone had a great chat in their breakout rooms, but if we want to continue any kind of conversation, please feel free to jump over to Rise Digital and continue the conversation under this event. We will also be posting this recording to Rise TV. And then along with the PowerPoint as well, we will upload that as well. So you guys can go back in case you missed something and review it. Thank you so much, Becky. This was great.
Thank you so much for having me. I love talking about this stuff. So anytime.
Thanks, everybody.
Thanks, Becky.
Thank you.
You're welcome.
Thank you.
Bye-bye.